I'm honored to speak here on behalf of the community of people living with HIV, and I'm openly living with HIV more than 20 years as for now, and also as a representative of community of people who use drugs or people who inject drugs, and of course I have lived experience with hepatitis C. I would like to present my story briefly. In a certain sense, it's a typical story of a person from my country and from Eastern European Central Asian region, from my generation. So I'm 43 now, I was born in 1980. So imagine mid-90s, after fall of Iron Curtain, after Soviet Union, we are teenagers, new substances in country, we are trying to experiment new experiences, and that's how I started to use drugs. And very soon found out myself as dependent on heroin. It turned to dark times, of course, you know, being a drug user in the country where you, according to the law, part of criminalized community. Of course, it was 10 years of, you know, avoiding contacts with official authorities, hiding from law enforcers, etc., etc. And yeah, it was horrible, but I was lucky one day to meet my friend who was working for harm reduction program. At that time, I didn't really know what is harm reduction, needle and syringe programs, but he invited me to come for clean syringes to this program, and that was, I think, the really turning point, and that's how people, like from communities I represent, that's how these people can have this first entry point, access to further linkage to services and treatment, life-saving treatment. I've been proposed to make a rapid test, and since 2003, I've been diagnosed with HIV and hepatitis C. Of course, it sounded for me as a death sentence. Let's say more as a death sentence because we heard a lot and had a lot of bias about HIV/AIDS, but maybe less about hepatitis. That's why main focus of my, you know, worryings and then finding the, you know, treatment later was more focused on HIV, and that's actually a big mistake. When we are losing attention in comparison with HIV and hepatitis C, we're losing attention to hepatitis. That's why my way to treatment of hepatitis C, I passed several stages. One stage of you don't have any information and you're not even seeking for treatment, you kind of feel yourself okay. Then when I start to feel some kind of symptoms and some friends, colleagues start to say that you should try to find some treatment, I realized that I've been proposed with the interferons with a cost of 12,000 euros, and as we say, you should sell your kidney to buy the treatment for your liver. Yeah, a next stage when there was only 100 free of charge courses of interferons, and for, you know, thousands of people infected, millions of people infected in my country, but and I've been said, like, we don't have a treatment for normal people, but you're a person using drugs, so please stay somewhere aside, wait a little bit. So finally, after 13 years of waiting, when direct-acting antivirals appeared, and I was lucky to have this treatment, just a 3 months treatment, 1 pill a day, and you're like, okay, I was suffering 13 years, losing weight, my color of my skin turned to a gray-green, you know, you always feel exhausted, other symptoms. It was really, really difficult to survive. And then just 3 months and 1 pill during the day, and you're cured. And you're thinking, okay, but why this treatment is not accessible to all people who need it? And that's actually, all these things actually caused my, my willingness to start working in the field, and I started working in the field of harm reduction and HIV. And I'm proud to represent today European AIDS Treatment Group, which is the oldest patient-led network of people living with or affected by HIV and other co-infections, including hepatitis in WHO European region. And of course, we definitely know how to connect people from communities usually left behind to this treatment. And I was always thinking, like, okay, we know we have so massive advocacy around HIV, tuberculosis, and today we heard messages about, Global Fund replenishment. I've been involved in that. Global Fund programs saved my lives as well. But I was always like, why hepatitis is not there? Why hepatitis is always like a forgotten, I don't know, relative or some, I don't know, poor relative. That's how we say in our language. And that's what we also realized on the country level in my work in Ukraine. And I was working for Alliance for Public Health. And you know that Ukraine, with this unique collaboration of civil society, communities, and government, we actually developed the biggest harm reduction program and prevention program in the Eastern European Central Asian region, including the largest opioid agonist therapy treatment, and of course, hepatitis C rapid testing and access to treatment finally turned available, and even with the increased state budget funding. But you know that 24th of February 2022, the war came into my country, and unfortunately, we know that these emergency situations, of course, creating the certain risks for public health. And but at the same time, we also know from COVID times that emergency situations is not only time of troubles, but also it's creating certain opportunities. And that's why I think it's something about supporting countries who can be drivers of changes in the entire region, like for instance Ukraine, or countries within this emergency context. So, talking about funding, as an activist of community, you hear very often from us, we need funding, please fund it. I really don't want that it sound like some kind of mantra. Funding is critically necessary. Funding is fundamental. But it's always a question to use this funding as much effectively as it is possible. And here I want to say that we should keep in mind about the proper collaboration of community, civil society, and government. We should keep in mind the funding for community-led and community-based organizations. As the community representatives, of course, we are that linkage with the people who usually left behind or who are hard to reach, and we know how to do this work. We know how to be helpful to governments in providing this access to proper people. Yes, as Dr. Michel mentioned, we have all tools, but all these components, vaccination, testing, treatment, it should have some integration. Integration not only within the hepatitis agenda, and I mean harm reduction programs, which is an amazing integrator of all these components for people who inject drugs, which is a key population, at least in my region, for viral hepatitis, but also integrated model of care when we're talking about co-infection of HIV and viral hepatitis. I want to say that it's very symbolic that it's a first time and first conference of its kind. I think it's not the last, but first time is always most memorable. That's why I really call donors, governments, funders, really to use this moment. I can say that my life is definitely proof that this program works. Donor funding works, your funding works. It works for myself, for my family, for my kid, who is a healthy kid, 4 years old now. I really want hepatitis to be sounded really loud on the 3 upcoming high-level meetings on tuberculosis, universal health coverage, and pandemic prevention, preparedness, and response. And I saw this paper. Yes, pledge form. It's just A4 size paper, right? But just imagine that this piece of A4 size paper will save hundreds, thousands, millions of lives of people, not just people who live now, our citizens, our colleagues, our family members, but it's really investment in future generations and future of our countries and our children. You can see as Ukrainian, I'm in Ukrainian short named Vyshivanka. It's not just some short, it's very spiritual sign for us, and we wear it for very special moments. It's a symbol of freedom, symbol of dignity, symbol of courage, symbol of strength and braveness. And I wish all of us this strength and braveness in investing in hepatitis, in fighting hepatitis. Let's end hepatitis till 2030. Let's do it together. Thanks.